Hi everyone, Dr. Nemechek here. I want to review for everybody why leaky gut causes so much inflammation. Okay, like just really what's going on. And so what we have here is, you're probably familiar, is my graphic in the book. And so you have stomach, flows into the small intestine, flows into the large intestine. And we've got these groupings of bacteria live up here. These guys live down here. There's very few bacteria in the small intestine. Many researchers have even used the phrase like almost sterile. And then, but for every one bacteria up here, you'll have 100 million down here. So you go almost sterile, 4 trillion bacteria. Okay? Then to get autism, you have to have this. These normal bacteria in the wrong place. And when this happens, it's 1, maybe 2 species. Okay? And you'll have 10,000, 100,000 times the bacteria. And it's not built for that. And stuff literally starts leaking through the seams. This process is called intestinal permeability or bacterial translocation, but in, the general public calls it leaky gut, which is a fine term anyhow. And you're going to have fragments of bacteria going through here. You're going to have fragments of food molecules, other things, peptides flowing through there. And now I'm going to show you. We'll cut this away. Now, this round thing, this is the small intestine. Kind of, it's a tube. We cut it like this. This is a mouse, all right? Ours is built the same, except for these villi in us are small, much smaller. They're this long. But nonetheless, you have very few bacteria up here. Remember, it's almost sterile. And so to prevent things from leaking, the barrier here is only 1 cell thick. It doesn't need to be very thick, all right? But the problem is, now it's not thick enough for when you have 100,000 times the bacteria. And literally this barrier stuff starts leaking through the seams. And when it leaks through back here on this backside, that's 70% of all the white blood cells in the body that will release inflammation into the bloodstream. These inflammatory chemicals called cytokines leak them into the bloodstream. If these cells come in contact with something that is not the person's proper tissue type. I mean, it's kind of like trying to reject a kidney in a transplant if it's not matched correctly. All right? These cells are going to react to fragments of bacteria. These cells are going to react to fragments of, heck, banana. If you do your allergy testing, all these allergy, these plasma mast cells are right there. And so the foods you eat turn up positive in the allergy blood test. It's not that you have allergies, it's that you're leaking into the body. And if you have a mast cell disorder, people talking about that, and some doctors measuring these histamine levels and so forth and whatnot, 70% of the body's mast cells are right here. So you don't really have a mast cell problem. You have mast cells reacting the way they should because you got leaky gut. 70% of the entire immune system. We think of white blood cells as circulating around the bloodstream. Most of them are right here, sitting in the tissue, just waiting to do their job. So that's why when you get this leaky gut, you get this massive release of inflammatory stress. And if we are not successful at getting the gut like this, people don't recover, whether you're a child or an adult. Okay? That's why it's so, so, so important. All right, everybody, have a great day.